Hi everyone, my name is Michelle Jaquetta. I'm the Public Information Officer and Emergency Preparedness Coordinator here at Tuolumne County Public Health. We're here with Dr. Liza Ortiz, our new and returning Interim Health Officer, who's going to talk with us a little bit about data reporting and what we share with the public on identified cases for infectious disease. So thanks for taking this time, Liza.
Sure, happy to help and happy to explain this to the public. We've gotten a lot of comments that people are struggling to interpret our information. So we're happy to explain. This is something we do all the time, year-round, for all kinds of different diseases. And the way we're reporting it out every day on Facebook and to the press is similar to how we handle cases day-to-day, whether it's COVID-19 and coronavirus or other diseases that are reported to us. So sometimes we know about the lab ahead of time that someone has ordered it. Sometimes medical providers call us and we help them decide what to order or how to work something up. Sometimes we hear about it from the lab before we hear about it from anyone else. We have a little bit of extra access to this information before some medical providers do as well. And so there's a lot of ways this information comes in, and sometimes the information that comes in doesn't necessarily apply to our county, but we work it up and figure out where it needs to go. So that explains sort of the rolling information in the last column on the right. So starting from left to right, we'll explain the table. This information is something we release every day, Monday through Friday, and if something happens on the weekend, we can update on the weekend as well. So in our first column, we have total tested. So this is all of the tests that we know of having been ordered. There can be some extra tests that while they're being worked up, we don't find out about until we get the results, but total tested is a pretty solid number for us. And we've gotten the vast majority of the information before the results are available for most tests. Total pending right now is a pretty low number, which just shows that the capacity for labs, whether it's in a hospital or a commercial lab or in the public health lab, is catching up and getting better, getting faster. So total pending means we don't have the results yet, and we know that it's coming. So that number changes pretty frequently as we get the results day to day. In the third column, we have total negative, which as you can see is the vast majority of our tests. It's a great bit of news right now that the majority of our tests are coming back negative. So in the total positive column, we have the total number of cases that have come back positive in residents of Tuolumne County. This applies to all kinds of diseases across the state, and when we report to the feds, it is done by your residents. So we had one instance of a Tuolumne County resident who acquired the disease out of county, but is a resident of Tuolumne County. So that number currently is 1. The total death, knock on wood, it stays as low as possible. Right now it's 0. And then we have this extra column, which is our sort of working column that we still think is relevant for the public to know about, because sometimes there can be non-residents that are in our county. We all know that we often travel other places ourselves. We know plenty of people from other parts of California and other parts of the US come into Tuolumne County for a variety of reasons, whether it's for essential work, whether it's to care for family, whether it just so happens that you were here in this county when it happened and you did the right thing and you sheltered in place. So right now, that number shows 1. We have worked 2 different cases that have fallen into this category, one of whom has already been moved into the reporting for their actual official residence, one of whom is in that process of being transferred to their appropriate residence. We still report it just because if it impacted the county, if it meant that we needed to do an investigation to determine if there were close contacts or to determine if there was an exposure, we needed some place to explain that, and that's how we do it for all sorts of different diseases. So we just are trying to stay consistent with how we normally do disease reporting. So that explains the table. We also do press releases and update information just as things are happening. So you may see a press release that says we're working on an investigation, here's what we know so far, and then we'll update that. If a disease investigation can go very quickly, we can release all the information at once on the same day. We've been very fortunate, and some of our cases haven't had very much contact with other people because they have done the appropriate thing and have been isolating and staying at home. We have to follow patient privacy laws, and that's just the fact of how things work anywhere in the US. Whenever it impacts the public safety, we may be able to share additional information as that comes up. We have to reserve the patient's privacy as much as possible. If it's not impacting the patient's safety, we cannot violate that. But if someone were to have some significant exposures to other members of the public, we would be able to say where and when that occurred. In our current cases that we have worked, that has not been an issue because people have been staying at home and isolating, and we've had some great success in staying in containment so far. And that is all due to everybody staying home and only conducting essential business. We really appreciate how much sacrifices people have been making. We know it's really hard, and it's helping enormously to save lives and to prevent going into a surge mode, which could be very devastating for a community with one hospital and a very large number of elderly patients and patients at risk. So thank you so much for your sacrifices and continuing to follow the orders and guidance. And if you have any other questions, please let us know.